Dizziness and imbalance are a growing health concern among older adults. The reason this is concerning is because those individuals are at a greater risk of falling. So today we're going to dive into some reasons why individuals might have vertigo. Today, I am here with Dr. Sandra Miller. She is one of the co-owners of Complete Hearing, as well as she heads our Balance Clinic. Thank you for joining me.
I'm excited to be here.
So tell me a little bit about what the vestibular system is and why we are interested in it and how it contributes to our balance.
Well, if you think about moving upright and walking and moving your head and bending over and knowing where you are in space, super important for the balance system to be working appropriately. So inside the inner ear, we have a very fascinating system, kind of like a gyroscope. So if you think about, we have 3 semicircular canals, which are your balance canals. So think about every day when you're doing this or bending over or moving your head, we call that pitch and yaw. That means how we move our head back and forth. Those semicircular canals help us know where we are in space. And then you have 2 balance receptors called the saccule and utricle. I know, fascinating, right? Really cool names.
It is.
That helps us know where we are in space when we move up and down. So in terms of vertically and then horizontally, like when you might be line dancing.
Hey.
Yeah, so it's a very intricate system that the balance centers are all working together. We actually use 3 things to maintain our balance. We use our vision, we use our somatary sensory system, that means how we feel the ground, and then we use our inner ear. So there's lots going on when you think about having some balance concerns.
Fantastic. Okay, so tell me about one of the main vertigo symptoms or complaints you get in the clinic.
I would say the most common thing we see is positional vertigo. That just simply means, hey, you know, when I get out of bed sometimes and I'm getting up, I get this brief episode of dizziness. The room spins for, maybe 15 seconds, then it goes away. I'm looking up to change a light bulb. I'm on a ladder doing some kind of work. I'm bending forward. I get this brief episode of dizziness, and then it goes away. It's kind of transient, but it's always kind of in this positional movement. So we see it lasting a short period of time, probably around less than 30 seconds. It's true spinning, and then it goes away.
Okay, so how do you test for that?
Such a great question. We do a test called the Dix-Hallpike. Essentially, we try to get that balance canal into a position where we can find out if you have this. Well, what does it mean if you have this? Simply means you have these little sensors inside your balance canal that have little calcium deposits attached to them. They're called otoconia. It simply means ear stones. And so what happens is sometimes they naturally become loose off of those balance sensors, those hair cells, and they kind of float, and they typically should dissolve. But for a lot of people, they don't dissolve. And so there's these little free-floating crystals in the balance canal. And so when you're tipping your head, the nerve receptors are going, you're moving, and this isn't right, and it's giving the brain the wrong information.
Okay. How would you treat an individual? So you test them, you see that they have BPPV, then what is the next step in terms of treatment?
The best thing about this is that it's the most treatable. There's no medications you need to take. There's no surgeries. It's simply a repositioning maneuver that we get those crystals from where they don't belong and put them where they do belong. And then they actually dissolve. We have a lot of patients who want to treat themselves at home, and we tell you, please don't do this. What happens sometimes is those otoconia get put in the wrong balance canal, and then you have worse dizziness. The positioning of the head is very important. Imagine that those little semicircular canals are all angled in different positions, and we have to get those canals in the right position to make sure we get it treated accurately. And once we treat them, usually it goes away. Reoccurrence is a little bit common. We find that this is very common with people who have diabetes, cardiovascular disease. It could be head trauma, not as often. But we also find that if you have vitamin D levels that are too low, what happens there is that calcium absorption is supported by vitamin D. And so we always tell patients, if you have benign positional vertigo, BPPV, please make sure you check with your physician your vitamin D levels. We want to prevent those crystals from continuing to become loose.
Okay, so it seems like the treatment is fairly easy.
Treatment is super easy.
Yeah.
People always think about when they're going to come in, I'm going to get dizzy, and what if I get sick? It's very momentarily there, and the treatment goes really quickly. And so we kind of call it flushing the pipes. That just means we're going to get those crystals out of where they don't belong. And then if you have treatment, if you have it reoccur, we ask you just to come back, and it's a simple, it probably takes us 10 minutes.
Oh, that's fantastic.
I know, and to not be dizzy again.
Yeah.
Yeah.
So we say a lot here, being dizzy isn't normal. So if you are feeling any of the sensations that Dr. Miller spoke about, or if you have any of those risk factors and you start to feel kind of dizzy, or you have vertigo, or you're kind of off balance when you're walking, please talk to your primary care physician and also reach out to Complete Hearing. We work with partners to help support us in terms of your treatment plan. So it doesn't just always stop here. We have other individuals that support our team in terms of treating you and making sure that you feel the best you possibly can.
Yeah, I think it's really great that when we find this also, and if we find something else going on, that I love what Dr. Schott says, is that we have other partners we work with. So if we find it's not just positional dizziness and it's something else going on with your system, we check it from top to bottom. We partner with physical therapists. We work with ear, nose, and throat physicians. We work with your primary doctor to make sure you get the best assessment and best treatment.
Thank you so much. Anything else you want to add about balance, vertigo, dizziness?
This is the place to be.
It is. So if you know of anybody who has any of those symptoms Dr. Miller discussed, if you have questions, concerns, please head to our website. We have linked it down below. You are always more than welcome to give us a call and we can get you scheduled and talk through all of this with you. Thanks for diving in with us.